Okay, so yeah, we're going to go now. So welcome everybody for this afternoon lecture. Thanks for coming. I'm going to get started right away because we want to leave lots of time for discussion. So if I can get my computer to move forward, I just want to start with land acknowledgement. The University of Calgary, located in the heart of southern Alberta, both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, including Chiniki, Bears Paw, and Goodstoney First Nations. The City of Calgary is also home to the Métis Nation of Alberta Districts 5 and 6. So the objective of today is really to discuss issues and ideas that may arise when one wants to include an ethnographic component in their health research study. And there's three of us presenting today. We're going to try to keep each of our presentations fairly short, so we leave lots of time for discussion. So I'm going to start off. So I'm a health researcher, and I was the one who sought to include an ethnographic component within a new research study. Then we'll have Warren Wilson, an anthropologist, and he tries to figure out what this and other health researchers really want. And then he's going to be followed by Noemi Uribe de la Rocha, a graduate student in anthropology with a background in health and nutrition, who maybe you could think of as being caught into these different sort of paradigms. So a little more background on myself. So I'm a clinician, I'm a child psychiatrist, and have a interest in a variety of things, but including parenting behavior. And I'm also a health researcher and have a particular interest in methods and measures. And this initially was around epidemiology, measures and concepts through some additional training in public health and population. But subsequently, I became more interested in sort of mixed methods, range of methods, interface of qualitative and quantitative methods through a PhD I did on health research methodology. So now I want to just talk very briefly about a case. So a case meaning a particular research study, because I think this example may illustrate an attempt to incorporate an ethnography and sort of brings up some issues. I don't want our discussion to sort of be limited to this, because I want it to be a little bit broader, but I thought it'd be helpful to talk around one sort of specific attempt. And this attempt also sort of brought the three presenters together in this, what you might think of as an attempt at transdisciplinary approach. And the particular study is focusing, it's an ongoing study, measuring parent disciplinary behavior in low and middle income countries. And I'll just give a little bit of background to the case, trying not to get too much into the weeds here. Most of you, or probably all of you, are familiar with the United Nations Sustainable Development Goals, and that you probably know there's 17 goals. You may know that within those 17 goals, there's 169 targets, and within those targets, there's over 200 indicators. And I'm interested in one of the indicators. So indicator 16.2.1 is operationalized as follows. It's the proportion of children aged 1 to 17 years who experience any physical punishment and or psychological aggression by caregivers in the past month. And this is done sort of typically at a country level. Now, this indicator is housed under target 16.2, which is to end abuse, exploitation, trafficking, and all forms of violence against and torture of children. And this target is under the very broad goal 16, which is to promote peaceful, inclusive societies, et cetera, et cetera. Now, I'm interested in how indicators are measured. What is the data underpinning these measures? So for 16.2.1, it's based on a set of questions that are asked of child caregivers that are embedded in household surveys. And the most common surveys that are used to capture this data are called the multiple indicator cluster surveys, or MICS. These are standardized household surveys. They're conducted in many, many low and middle income countries and a few high income countries in more than 122 countries. Currently, there's a very rigorous sampling method to obtain nationally representative samples. And the households that are selected, then there's a suite of standardized questions asked of different members of the household. The discipline questions are typically asked of the mother. These surveys are facilitated by UNICEF, and I won't go into too much more unless you want to in the discussion. You may or may not have heard of the demographic and health surveys, which is a very similar initiative in other countries. It's pretty much parallel, but I won't go into any more detail on that. Okay, so that's where the data is sort of being collected. So what are the concerns? So this set of questions and mix is used to measure parent disciplinary behavior and to generate that indicator come from these very specific sort of questions embedded in these national surveys. Unfortunately, this measure did not really go through appropriate steps for instrument development. So as a lot of you know, developing a measure, a quantitative measure to capture a complex construct is hard, takes a lot of work. Some of the steps would include detailed and systematic field work in targeted locations to explore the phenomena of interest. If you're trying to develop a quantitative measure, developing an item pool, piloting those items, refining your instrument, and doing psychometric assessment, amongst other steps. Unfortunately, this didn't happen. So rather than this instrument development approach, a set of questions from an existing US instrument that had been used in US populations was truncated, shortened, and inserted in this survey, which captures many, many other sort of indicators and details. And unfortunately, there's really not been systematic assessment of the ability of this US shortened truncated instrument to really adequately capture these disciplinary behaviors and violence exposures in the household in low and middle income countries where it's mostly used. So this was sort of the basis of our SSHRC grant that we put in and got funded to look at this issue. And we proposed in that to do a three-part study based in a single LMIC, the Dominican Republic, and with the idea that our approach to attempt to measure these constructs could serve as a model for other LMICs. So it's three parts. The one I want to focus on is part one, which is some qualitative field work to explore this phenomena of parent discipline. And then we have other stages that I won't go into. So then what was my aim in reaching out to anthropology related to this first part? Well, the study overall, and in particular, the first part. Well, one, as you know, there's this expectation or increasing expectation of studies being transdisciplinary. I was interested in particular in strengthening phase one, strengthening the field work, strengthening the qualitative investigation. I also was interested in having an anthropology student to help with field work. And another piece was there was some parallels or potential parallels with how others have approached measurement challenges around sort of health projects that I was sort of familiar with. And there'd been concern. So this literature from the 80s that I was interested in several years ago, that there was a concern that a number of our health initiatives, or at least some health initiatives, they're aimed at sort of priority health conditions. In particular, I was interested in childhood diarrhea. There was concerns that a number of them were failing, at least in part, given the lack of understanding of those rolling out the health initiative in understanding local disease constructs and related contextual factors. And this had been pointed out by a number of people, but in particular, there's some social scientists, a number of them were anthropologists, who argued that some of these failures might be reduced if we drew more from some of the approaches used by social science to strengthen these health initiatives. The challenge, however, is that there often isn't resources, either time or money, to complete, say, comprehensive ethnographies prior to launching, say, a priority health initiative that's on a tight timeline. So consequently, an approach was developed primarily by anthropologists to develop sort of a highly specific social and cultural information data collection approach in a very truncated way to provide information to these health initiatives that were being pushed out. It was stressed that this wasn't supposed to be a replacement for comprehensive ethnography, but under conditions of limited time and resources, some strategic effort using these approaches may inform these initiatives and would be better than nothing. So that interests me. And this approach has been reported on for years and years and years for a number of sort of health conditions. You may know it as rapid assessment procedure or rapid ethnographic assessment. Also, I've seen called rapid epidemiological assessment because sometimes it's done in a stage prior to launching sort of an epidemiological survey. And it has even sort of earlier roots in these rapid rural appraisals that were to inform agricultural projects back in the 70s. And I was particularly interested. So many years ago, I had worked on some childhood diarrhea stuff, and I was particularly interested in a group that focused on this to try to strengthen health initiatives aimed at reducing childhood diarrhea, which many of you know is still a major cause of morbidity and mortality in low and middle income countries. And this approach that they developed has been rolled out for other health priorities, including childhood pneumonia. So I was interested in their sort of approach to try to capture measurements of constructs to apply it to this study and this trying to bring in expertise from anthropology. Now, subsequently, with many conversations with my anthropology colleague who's going to talk next and further reflections, I'm not sure if I sort of captured the bigger picture. So in reflection, really, this particular case that I worked on, I think a bigger drive was probably my more limited interest in including additional methodological techniques like cognitive interviewing to strengthen my fairly narrow measurement interest rather than maybe tackling a broader use of ethnography. And rather than maybe a transdisciplinary approach, perhaps this case is maybe more really an example of a modest expansion of multi or mixed method approach. But I'm going to stop my presentation here and hand it over to Dr. Wilson. So I think I just stop sharing and let Warren pull up his slides.
Great. Thank you very much, John. I presume you guys can see the slides. If you can't, just let me know. Yeah, so just building on the work that John talked about there, I'm going to tell you a little bit about what I do and about my experience in working with biomedical teams. And I've been working with biomedical teams as an anthropologist since 1992. And so, and it's been a rich learning experience. But just let me give you a bit of background. You probably all know that anthropologists are interested in studying human variation. Biological anthropologists are ostensibly interested in understanding human biological variation. And so they might ask questions, for example, about try to figure out how we might explain variation in skin color. They might, for example, try to understand variation and adaptation to high altitude hypoxia that you would see, for example, among the Aymara and the Tibetans. And perhaps more relevant to your own work and my own is that as we would look at kind of trying to understand the risk factors for, in this case, variation in gender mortality ratios. And in doing so, we're interested in human variation or phenotypic variation. And when I conceptualize this, I think about human variation as arising generally from a mix of genetic variation and environmental variation. Most of the work that I do, not generally with biomedical teams, is informed by evolutionary theory that helps me to form questions and provide answers. But it's also informed by environmental variation. And when people think about anthropologists, they almost invariably are thinking about culture. So if I tell someone I'm an anthropologist, they'll go, oh, I love Margaret Mead. They don't know anything about kind of biological anthropology, and that's fine. I mean, we're just terrible at kind of explaining to people what we do. And within the domain of most people involved in kind of biomedicine or public health, they think about kind of drivers of health outcomes as cultural drivers within the realm of social determinants of health. And in fact, this is what brings me to your parties often. And so you're there in the field and you're trying to understand a particular health outcomes. And you might say, maybe it's not all biology. Maybe in fact, we need to invite somebody who knows something about culture to the party. So they call the anthropology hotline, and I happen to be there that day, and I pick it up and I join these folks on their projects. And it occurred to me as I was walking to campus this morning that the very first project in which I participated was one in which team of physiologists and physicians working in Cali, Colombia, who were trying to understand risk factors for parasitic infection and diet among kids and diabetes among adults, said, wow, we need to include a cultural component here. So they invited my supervisor, Darna Dufour, to join them on the project in Cali. And I was dragged along as a graduate student and had my first exposure to working with such teams. And so before I go on, I'm going to talk a little bit about how we measure culture. I just want to make sure we're all on the same page when I define this, when I talk about culture. As you probably know, it's a somewhat contentious issue within anthropology and even outside of anthropology. But I'm going to follow Frans de Waal, the Dutch primatologist who passed away this year. And Frans de Waal said, culture is how we do and think about things. It is transmitted by non-genetic means. So, for example, if you're walking around Calgary on any given evening, or actually particular evenings, you might see this. This is a manifestation of a cultural trait. That is like fans supporting their local team. Okay, so how do we measure culture? How do we operationalize this concept? It's obviously it's not easy. I've been doing this for a long time and I'm still not sure how to best do it. But we might start with something like this. We didn't actually ask this question in Mwanza. I just plugged this in here because these are the questions that we're asking in the Dominican Republic. We might ask using a questionnaire, how do you discipline your children? That's one way we can approach the answer. Another way would be to immerse ourselves in that culture, live there for a long period of time and observe what people are doing. You might ask them how they discipline their children, but you'd also have the lived and observation of the lived experience of the people there. This is kind of your classic ethnographic approach that John mentioned in his slides. Okay, obviously there's a tremendous range of ways we can do this between these two, but this gives you a broad sense of what we do. But in almost every project I've worked on with biomedical teams, we've used this approach, the kind of the questionnaires. And I've been invited on projects and I'll say, why do you want me to come? They're like, well, we want you to do an ethnography. And it's like, that's cool. So what did you have in mind? And they'll say, we've got a questionnaire for you and we're going to drop you off in the morning and pick you up in the afternoon and we'll have our ethnography. I'm like, oh no, like that's not really what I had in mind, but I'm still, glad to be along. So maybe we can meet in the middle somewhere. So that's normally what happens. This is what I would rather do. I'd much rather immerse myself in the community to gain some understanding of what's going on there. So why would I prefer this over, for example, a questionnaire? And why would I lobby John? Like, John, can't we live in the DR for 2 years to do this, to kind of gain more insight into disciplinary strategies of parents? So why might I do this? I'm going to give you one example of why we might do this from work that's ongoing in Nicaragua. And so in 2015, with a team from the United States and Nicaragua and Canada, they initiated this project in northern Nicaragua. It's a small farming community known as Los Robles. And in Los Robles, we were interested in a suite of maternal, neonatal, and child health outcomes and collected a great deal of data on these and continue to collect data on these outcomes and their drivers. And we did this just like we're doing in the DR and just like I've done elsewhere, using questionnaires. And so we focus group questionnaires. We designed them over a period of 6 months and then rolled out the project with support from local assistants. And in these questionnaires, one of the questions we asked was about maternal nutrition or maternal marital status. And one of the things that was quite surprising to us was this variable. That is that 57% of the mothers in this community that we sampled, and we sampled every household that had a kid under the age of 5 in this community, 57% of the mothers are living common law. They're not married. And that was kind of surprising to us. It was actually a bit of a red flag. And it was a red flag to us because the literature tells us that for your health, it's better to be married. And I'll just refer specifically to the work of Rocha here, Rocha and her colleagues, in which they point out that women who were single, divorced, or otherwise not married or widowed had lower odds of good self-rated overall health compared with married women. And so we collect these data, and then we kind of just do some quick and dirty bivariate analyses. And what do we find? We find no difference in self-rated health. We find no difference in, we have this health index known as an allostatic load measure. We find no difference in the allostatic load measure. And when this first happened, one of my colleagues, who was a sociologist at Ohio State University, looked at this and said, Warren, like there's clearly something wrong with your data. How is it that you see no difference between these mothers? Like it just doesn't make sense. But I had the benefit, so she's an excellent sociologist, but I had a benefit that she didn't. That is, before I even began to collect data, I lived in this community for 6 months with my family. My family and I engaged in every task, like a whole lot of times. We picked a lot of coffee, shoveled a lot of coffee. My kids went to the local school, et cetera, et cetera. And so we were just trying to get some insights into the local community. And one of the things I took away from it that informs my colleague's question from Ohio State was that this is a heavily Catholic community. When you are married in the Catholic Church, as you might know, it is very difficult and expensive to get a divorce. These are poor farmers. They don't have the money to pay for a divorce. This is also a community in which machismo is quite common. And so we have high rates of intimate partner violence. We have high rates of alcoholism by males and so on. And so what I learned and what my graduate students have learned over the time and spending time in these communities is that women do not want to be stuck in marriages. They want to have an option to get out of those marriages if they can. And so if they're married in the Catholic Church, that's hard to do. If they're living common law, they could throw their husband's stuff out ostensibly throw their husband's stuff out in the front yard when they're sick of him. And it actually happened. Like that actually happened when I was there. Like several women, sick of their husbands coming home drunk or behaving poorly, threw their stuff in the front yard and said, "You're not welcome at home." And so this kind of rich ethnographic experience provides insight that wasn't provided in the questionnaires that we utilized. And I probably wouldn't have framed the questions about it in the questionnaires anyway, because I didn't even know this was a thing. And so this is why I love to do kind of these kind of deeper dives into kind of the cultural context of the populations that I'm studying. And so the goal of any research, of course, is to kind of move us from kind of fiction towards truth. And we take baby steps in this direction. And you might ask, how can you do this? Well, you could do this with questionnaires. That's an effective way of kind of moving in that direction. You might use biomarkers, as we've done in a number of places, to look at, for example, immune function or stress. You might collect dietary intake data, or you might conduct kind of rich ethnographic research in which you live in the community for a long period of time. Every one of these, I would argue, can kind of move us towards the truth. Now, there's a note here, and John mentioned this, that is that there's differences in duration. So questionnaires and biomarkers you can collect very briefly, very quickly. You know, dietary intake data take a longer period of time for a variety of different reasons. And there's no end to the amount of time you need to be spending in a community as an ethnographer. I'm reading a book by Zadie Smith right now called The Fraud. And in that book, an enslaved man leaves Jamaica for the first time in the 1830s and goes to London. And when he arrives at London, he's completely baffled by the people he sees. Like he's trying to understand what's going on there. And this is what he says. He says, one lifetime was not enough to understand the people and the words they used and the way they thought and lived. That's exactly the way I feel when I'm trying to conduct ethnographic research. One lifetime is not enough. So it takes forever, as John suggested. And on top of that, there are different manners of interpreting the data. So questionnaires, biomarkers, dietary intake data, and interpretation is relatively straightforward. The interpretation of ethnographic data is much more complicated and some would say anecdotal. And so people are like, oh my gosh, we're not going to do this. So when I go back to kind of what brought me to the party, this kind of desire to understand culture from maybe a different perspective from what normally would happen in biomedicine or public health. These folks look at this and go, oh my goodness, like there's no way we're going to let Warren, spend 6 months in community. We don't have the budget for it, et cetera, et cetera. And so it doesn't happen. Now, what I want to make very clear here is that I'm still despite the fact that I can't get everything I want, I'm super grateful for this opportunity. And you know, it's really been a rich experience for me to work with biomedical and epidemiological teams. I've learned a ton from them. I greatly appreciate having a seat at the table, and kind of with this kind of small goal, maybe helping to move us further along towards our understanding of the drivers of the health outcomes, or the variables in which we are interested. Thank you. I'm going to turn it over now to Noemi.
Thank you. Okay, so I'm gonna assume you can see my slides now. Okay. So, first of all, I'm gonna start with a little bit of my background before starting with my experience, which is what I'm gonna talk about today. Well, I'm a nutritionist, and when I was studying nutrition, I got interested in community nutrition and food insecurity. So that led me to study a master in science and public health. And I had the opportunity to do research on household food security perception and child dietary diversity. Currently, I'm starting my second year as a PhD student in biological anthropology, and I'm still interested in food insecurity. And I'm hoping to conduct my research based on that. So as you can see, I have previous experience with public health research, which is it's a little bit, but it's something. And from my previous research experience and what I'm learning now from anthropology, I can tell that there are differences between disciplines that can obviously make it challenging to incorporate them into the same research. But specifically, well, we can tell that there are methodological differences, like between public health, for instance, which relies on quantitative methods and statistical analysis specifically, while anthropology primarily uses qualitative methods. But also, I can tell that ethnographic work requires longer fieldwork periods for immersion in the community. Nevertheless, I think, well, the idea of this is incorporating or giving contextual information to complement quantitative data. And this can be helpful, like for instance, to identify cultural aspects that influence health behavior, but also it can help to develop more targeted like service, or even to implement a program in a specific place. So now I'm going to talk about specifically my experience in the Dominican Republic, which I had this past summer with the research conducted by Dr. John McLennan. And during this field work, what I did is I was visiting the community clinics with Maria, who is a doctor who works as a supervisor for government health programs. Also, part of my activities was assisting with the focus group, also visiting households, conducting interviews and transcribing them, also assisting on the first stages of data analysis. But for all this, was basic to speak the same language. So that was very helpful, obviously. Otherwise, I wouldn't understand what they said or what they meant. So here you will see some of the pictures of the places that I visited when I was there. These are different kinds of households that we were doing or conducting the interviews. And here you can see part of the team that was working within this research. And so now I'm going to talk about, or like in general, about fieldwork challenges from my own experience. And here I'm going to start with saying that some of these challenges are the same, independently what kind of research you're conducting, but some others come from your immersion in the community and living the way they do. So First of all, safety. It's depending, obviously, if you're going by yourself, you're within higher risk. So you have to be aware of where you are and the people you talk to. So take care of your belongings, that kind of stuff that you already know, right? But also there's other kind of things that you have to be aware, and that is food and water contamination. Like for this one specifically, I know you can get sick eating whatever you are in the world, but in this specific case, I took a class before going to the field work with Dr. John McLennan, where we did some data analysis from mix, and that was specifically for water contamination. So we knew ahead that water contamination was pretty high in the Dominican Republic, even though like considering bottled water. So that was something to be aware of. Also, contagious diseases, like for this, you can take vaccinations, of course, or you can use like mosquito nets or even spray for bugs. Something that you cannot control and definitely will be challenging is the weather. In this particular case, heat was definitely challenging. As I said, I was living with the people within the community the way they were living. So no AC. Which means that when there were like power outages, you cannot sleep because you didn't even have a fan. And thinking about the mosquitoes, that's not a good combination for sleeping. Now rain, it was rainy season, so that makes like challenging to get to the community. So sometimes we had to cancel some interviews that we had already scheduled for us to go visiting to households because there was no way that we could get access to those places. And something that you cannot definitely control is hurricanes. In this specific case, that was hurricane season. So I had luck that I didn't leave that experience, but I actually flew one day before a hurricane was passing by the island. And also to keep in mind is food for different reasons, but that could be challenging. Either you have an allergy or intolerance, or based on your preferences, because that would be different than what you know. Again, you will have what people have to offer, and you don't want to be rude. So at the same time, you have to take care of yourself, and sometimes it's not easy to draw the line. We had like one experience at a household. Dr. Wilson and I went visiting this household, and this lady was very kind, and she offered us. She didn't even ask, like she just handed 2 cups of juice. We were not concerned about the juice because it was bottled, but it had ice. So we didn't know what to do. So we figured to just drink it up very quick before the ice melted. We didn't get sick that day. That was a happy ending, but that was something that we had to deal in the moment because we didn't know what to do. And another thing is one of the days I was served, it was not plantain, but banana boiled, but green banana boiled with cheese, melted cheese and red onion. So that's not familiar to me. That was just something new. So sometimes you will eat what they offer to you, and it's not that you will get sick. It's just that it's going to be different from what you know. So that could be challenging sometimes if you're going to spend some time there. And at the end, of course, you will have fieldwork rewards. Like in my case, food is from my particular interest, especially for my own research topic, which is food insecurity. And this was a good opportunity for me to explore people's food experience. And of course, furthermore, food is a great way to know a new culture. And well, among all the new flavors and textures that you will know, there might be some that you just don't enjoy too much, but there are others that you will just love. And of course, the most important reward, in my opinion, is the people that you will meet and the stories that they will share with you when they feel comfortable with you. and of course the experiences that you will bring home when you leave. So that was my experience. Thank you.
Thanks, Naomi and Warren. So we've got a couple of questions in the chat box. I think the structure is you got to put your question in the text box. So we'll try to carry on a conversation that way. And hey, Frank's got a couple of questions for us. Good to hear from you, Frank. So this is there's a couple of questions here. Maybe I'll take a short stab at it, and then I'm going to turn it over to Warren because it's more in his sort of field. But it's this issue around comprehensive ethnography versus maybe selective. How do you sort of deal with this limitation of time? What's sufficient? Um, so some pieces around that. So I guess the one thing. So I was quite interested in this literature around sort of diarrhea, and so one of the things, and I'm fairly narrow. I'm not a big thinker, so that sort of fits with me in all domains of life. But from a measurement point of view, so some of the studies around childhood diarrhea, they were interested in learning very specific things about childhood diarrhea in these sort of communities, as opposed to getting a good grasp on sort of how society is structured, things like that. So, for example, they would look at what words do people use when they're referring to childhood diarrhea. What's the range of words for that? What do people think are the causes of diarrhea in that community? How do they treat diarrhea? And that directly informed a fairly focused intervention. So the intervention interest in some of those studies was prevention is one, but the second one was around preventing severe dehydration in diarrhea, and it was the use of oral rehydration salts. So they needed enough understanding of what terms do people use, also how do they pitch oral rehydration solutions, how do they map on to people's existing constructs about managing the disease, what's caused by it. So it was fairly focused. So they didn't go in and live there necessarily for a long period of time. Now, part of their approach was to partner with local workers. So these were primarily American anthropologists, but they would train locals in some basic data sort of collection sort of strategies, partly because of the shortage of anthropologists, at least at the time, in those sort of countries that they could sort of draw upon. But then they focused quite specifically on those, tried to get a diverse sample because they were rolling on sort of a tight time period. So I guess the parallels I'm also have a very sort of specific sort of interest on language that people use to describe discipline, the range of sort of practices, what are we missing in there? So I have this sort of fairly narrow piece. Now, I guess the background is I've 25 years going back and forth in the Dominican Republic, and so and have worked with lots of sort of locals. So I've got a little bit more of that to draw upon. But it's a good question. And this also came up, I guess, with discussions Warren and I had in the field, where I'm going, we got to unpack this specific word and understand this, and we got to, and while Warren's saying, no, we got to back off and get a richer understanding of sort of the community, and then Naomi was expected to do sort of both. But let me turn it over to Warren. Just talk about this, trying to sort of grapple, I guess, with getting sort of enough information. I know you touched on it, but maybe you can expand on that.
Yeah. So Frank, thank you for your question. Actually, I think the answer. So first of all, I want to be clear. I don't mean to be sanctimonious. I'm not saying there's one way. I mean, there are many roads to Rome, right? And the road you take, I think, depends on the question you're asking. Like if when I go to the doctor and my stomach hurts, I don't really want him to conduct a rich ethnography. I want some medication to feel better. And so it kind of depends on the goal of the kind of intervention or the project, as it were. I would say with regard to what's enough, I mean, to be honest, it's never enough. And what this means is that I could spend, per the character in Zadie Smith's book, I could spend my lifetime in Santo Domingo and still have really no idea what's going on in these households, or have a very superficial idea. And so it's never enough. And I think what I take away from this, and I don't mean to duck the question, I think what I take away from this is that regardless of the approach that I take, or that John and Noemi and I take in this work, that we present it with humility, right? I mean, without a doubt, someone's going to come along in 5 years and find all these holes in the work that we've done. We just do the best we can, given the resources that we have, to, answer the question at hand. So I don't, what's enough? There, it's might be enough. It's enough given the resources that you have and the questions that you have. But in truth, there's never enough, right? There's no end to kind of the information that you can collect in this case. And I will throw a bone to John here. Like, he does have a rich kind of, John has lived in these communities, as he said, for a long time. And he's actually lived in the community where most people would never, most of us would never want to live. Like, he's lived on a cot on the edge of a street, essentially separated only by a sheet of plywood, for long periods of time. So he has insights that I lack, but that's in part because he has that experience. So Frank, I don't mean to duck your question, but yeah, I guess the answer is it depends. I hope that helps.
Thumbs up. Thanks, Frank. There's a new message. I'm just, oh, it's a thank you. Yeah, other sort of questions, or if people have, I know it's hard because it's a text box, but you got access to an anthropologist if you want to ask questions about your project. Should we ask for an extra $100,000 for this grant so Warren can live somewhere?
Yeah, there you go.
Yeah, Warren didn't get too much money. He got a plane ticket
Ah.
and a few meals for his time, which I appreciated.
Yeah, that was great. Oh, wait, there is a question. Oh, that's great.
Go.
Oh, thank you, Shannon. I don't know where you are now. Apparently you're here. But it's nice. It's nice to see that. That's great.
Other issues that maybe sort of came up, like the parent discipline's a little bit different in that there's a measure that's already being used. My hope is that it can be improved. And there's other measures that in these surveys have been improved when people have critiqued them enough. So, that's part of sort of my motivation doing it. But the other sort of flip side, I am sort of cheating a bit in that I'm drawing a little bit from these long-term experiences, having lived there. And then so the physician I work with, I've known her for like 25 years. My research coordinator in the fields worked with me for about 20 years, or at least 15 years, in different sort of field projects. And we've had endless discussions about child rearing. And, she's both of them are mothers in the community, so can speak from their experience. They both worked in sort of clinicals, and they have extensive social networks that we can sort of draw on. I have family in the Dominican Republic as well, which I tap as far as their experiences as well. So that maybe allows me to shortcut a little bit. I must say, similar to sort of Warren's comment, this idea of having long-term experience, like when I've thought about sort of, do I try out a new community to explore, I find it quite daunting even to think about it, because I can navigate pretty well in the Dominican, partly because of language and partly because of social networks. But if I had to start from scratch in a new community, yeah, I'd be a little bit overwhelmed on how to, and would have to need much more time than we've tried to roll out this project. Well, tried to roll it out sort of quickly. Logistically, it hasn't rolled out quickly. Okay. Other things, critiques, Warren or Naomi, do you have of the field work? I guess we could tell you a little bit about the study. So it's an ongoing study. A core structure is semi-structured interviews. So Naomi helped with some of the semi-structured interviews that we are doing with parents of children, looking at a variety of issues around discipline. We have a parent advisory group of Dominicans that inform that. We have some focus groups as well with parents. We also have partnered with a university there who are conducting interviews with professional psychologists, pediatricians, teachers, to get that sort of perspective. So this is our phase one that's going along, and that will inform a modified instrument that will then get a quantitative questionnaire that'll get tested in phase 2 and 3.
I will say this, like, one of the things that has often been sorry, my screen. One of the things that's often been a challenge, and I think it goes both ways for anthropologists and folks bringing anthropologists over to biomedicine, is we really speak different languages. And I've been trying to learn your language for 30 plus years, and I'm still kind of in kindergarten there. But the ability to communicate is not as straightforward as I had hoped. And so, we each bring our jargon to these discussions, and it's not helpful, I don't think. But fortunately, John has been patient, and all the teams I've worked with have been very patient. And so I'm kind of moving my way along and hopefully helping them to understand kind of the merits of an anthropological approach in their own work.
We're just going to try to switch so you can have sort of verbal questions in a sec here. The other thing, I guess, an aside, that sort of the language issue as one. So Naomi had a sort of short period of time, so a shorter window. Now, part of it because we have some connections locally and we're already sort of set up, we could roll that out. But the big thing was sort of language. So that was sort of a request to Warren. I want a Spanish speaking anthropology student. And this is where you'd need a ton of time. So if there's any language barriers, you'd have to be there a long time. Naomi was able to, jump right in, which saved us. You couldn't have gathered. I think you could have had an experience, but you wouldn't have been able to collect any data, any text data. You could go do some physical measures, I guess, but not in the short. She was there for 2 months in the field, so that would be sort of a big consideration. Now, I think in some of the studies I referred to, they partnered with so local providers or local partners to do interviews and things like that. But you really have to have expertise on the team with the language. Like, I mean, if you're going to spend 5 years there, I guess you could become quite good at the language. But I think if not, that would be talking about sort of sufficiency and resources. If you don't have enough language skills on the team, then it would be difficult. And the quality of the data would be worrisome. We have some bilingual folks on the team, and all the folks collecting data are all Spanish speakers as first language. So folks, if you're looking at the text, you can unmute yourself if you want to ask a direct question. You don't feel like typing today. We're happy to. There's a question for you, Warren.
Oh,
are you referring to the news?
Carly, let's see. When you mention it, are you referring to the idea that qualitative? No. No, with regard to communication, what I'm referring to there, Carly, is the fact that, and correct me if I'm wrong here, John, but my experience in biomedicine is that they think about these problems, and it's useful, right? Folks in biomedicine or public health think about kind of health disparities with a particular lens, whereas I come at it from a pretty different perspective. As I mentioned in one of my slides, I generally try to take base my work on evolutionary theory, and that that goes over like a lead balloon with my biomedical, most of them, with the one exception in medicine over here. And so, no, most of the challenge that we run into is kind of wrapping our heads around the approach that different disciplines take to understanding the phenomena in which they're interested, even if the phenomena are identical. It would be this, you're in political science, so if I was interested in power structures in my community or communities where I've worked, I might take, a particular anthropological perspective, whereas in political science, you might take political science perspective, and we might have difficulty communicating. We could still answer the question, but in a variety of different ways. I hope that helps.
Well, I guess the other thing I'd say, sort of historically, I think, and sometimes it's a bit stereotypical, but historically, I think we think of sort of medicine more interested in sort of quantitative biological pieces. I think that's certainly there's people that that's their primary sort of interest. I come in from psychiatry and mental health, so there's huge emphasis on psychosocial as well as the bio, but I think there's this rapid expansion of interest in social determinants of health. Nursing brings in a particular strength in qualitative research that I think spilled over to medicine now. So I think it's a much, and I think the rise of transdisciplinary sort of research. So I think it's not as challenging, I think, in most cases as historically, I think people may not have seen the role of additionally adding another discipline or a different method type thing. That's my sense, but maybe it's just the people I hang out with. Frank has his hand up. Go for it, Frank.
So sorry, we have been blackened out during the presentation. It was set up like that. I have another question regarding the language that you're using in your field work. And I'm hearing that you're all Spanish speakers, but I'm also wondering about the Dominican Republic's kind of post-colonial setting, and in what ways you can actually immerse in and speak also the indigenous languages, and how does that tie into the cultural interactions? We've heard about the marriage issues, for example. Perhaps those will be areas that you want to explore, especially when looking at these aversive attitudes towards children. Is it possible to get to the truth of the matter with Spanish alone? And how do you navigate this, perhaps also with interpreters and people on the ground who are helping your team when you're there?
So I guess a couple of things. The Taino people were completely wiped out, so there's no indigenous population in the Dominican Republic. There's some Taino blood but there's never heard anybody ever speak that. Sort of the bigger population is Haitian Creole. So there's a huge Haitian immigrant population, and so by far the largest minority population is Haitian Creole. So which would be interesting to explore. We didn't tackle it in this study, but I'm quite keen to sort of tap into that. So it's really universal Spanish, and most of Haitian Creole speakers that come over will speak Spanish because that's the language, but it's the only sort of official language. 99% of people, other than some new Haitian immigrants, may not speak sort of Spanish. There may be some English speaking sort of very small sort of communities, but it's sort of 98% or something like that. So that per se is not versus. I think Warren has other experiences, and Noemi in Mexico and Warren in other countries who could maybe speak to sort of this mixed culture. The Dominican Republic is, in at least from a language perspective, and so and all our staff. Well, that's not true. The staff I work with in the field are born and raised sort of Dominicans. So we have sort of direct access to that. I don't know if that directly answers your question for that, but the Dominican Republic is in some ways, I guess, easier to navigate than probably other countries that have sort of much more mixed population. So the biggest challenge right now, and it's also politically fraught, Haitian sort of immigrants in the Dominican Republic. So it's that's a whole other complicated piece. But other groups, there's very small European sort of setup. There's like a French community in certain area. There's a German sort of section, but these are very sort of tiny sort of communities. So I don't know if that maybe did or did not answer your question, but I can, Warren or Noemi maybe can speak from navigating other languages or sort of colonial situations or indigenous folk.
So I have just real quickly. So that's a great question, Frank. And in my mind, I mean, this speaks to kind of the paucity of kind of information that we utilize to answer these questions. And so you're you're probably familiar with, or maybe you are, there's an anthropologist named Eric Wolf who wrote a book that was influential to me when I was a graduate student called Europe. I think it's Europe and the People Without History or something like that. And so the point was the same point you're making, that is that how can we reach conclusions about, you know, culture if we don't understand it in light of kind of the historical developments that shaped it, such as colonialism? It's a fair question. And the fact of the matter is that in my opinion, good anthropology would incorporate archaeological data. It would incorporate kind of a historical consideration, as well as kind of this longitudinal, this evolutionary consideration. In practice, we almost never do that. And so it's just, for the same reason that John can't have me staying in the DR for 2 years. I just don't have the resources often to do that. I tried to do that in Guyana. I worked with the Makushi indigenous peoples of Central Guyana for about 6 or 7 years. And in that research, I worked with colleagues on the team that had kind of a deep historical understanding of what had happened with the Makushi since contact, as well as archaeologists in Guyana. But still, it's like, it's never enough. Like, again, I'll go to my grave dissatisfied with my work, because I just kind of feel like I'm just moving things along, maybe by a millimeter, towards a better understanding. And I'll just a quick point here, in all humility. I thought I spoke Spanish, then I went to the DR. I did not understand a single thing. It was awful. And I was quite shocked. I mean, I grew up near the Mexican border. I thought I spoke Spanish, and I went to the DR and I was hopeless. And so,
well, in your defense, I can say something about it. I did conducted some research in Chile as well, in Mexican, and I had a hard time trying to understand what they were saying, even though they were speaking Spanish. And same thing at the beginning in the DR, because they speak so fast. So it's not a matter of that you don't speak the language, it's that the accent sometimes plays a role.
Well, I think we're just about out of time, so I appreciate your participation this afternoon, your interest in this topic, and certainly reach out if you have any sort of follow-up questions. We're happy to catch them through our UCalgary emails. So thanks again for coming.
Thank you to all the speakers. It was a really interesting session, despite the few participants. I think on the departmental council slides, there was no Zoom link included, which might have made it difficult to find out how to access the session. And just before I need to spurt away, John, where are you now physically located? Are you back in the Children's Hospital, or?
So